mind, could you talk about the PCN event on the 26th of June as well, please?
Yeah, I've got that on the presentation, not to worry. So recording has started now, I believe. Yeah. So my name is Kasia. I work for the Lincolnshire Training Hub. I am working with the Lincolnshire Training Hub alongside Nirosha on planning different events, educational events for you guys. And before I hand over to Positive Health team, I just would like to share with you one of the presentations. Just bear with me one moment. Right, so with the Lincolnshire Training Hub, can you see my screen?
Yes. Yeah.
Yeah. And I'm sorry for the grid view, but I can't do much about it now. I need to work with a different laptop today, my packed up. So with the Lincolnshire Training Hub, we came with ideas for the educational events, and one of the ideas is those little bite-sized sessions. Today we're going to introduce you to Positive Health, which is the charity dealing with HIV patients, sexual health. The girls will tell you a little bit more about the team. And again, how you can utilize them on your day-to-day workload in the primary care. The next session is scheduled on the 20th of June, and that's going to be Dr. Irina Brook, and she will be talking about lower back management in a primary care. Then we've got a follow-up session with Dr. Graham Dantmore on the 18th of July. Again, continuation on the pain management in primary care. And the last one before the summer is scheduled for the 25th of July, and that's going to be Hepatitis C team coming to talk to us about day services, because the goalposts change when it comes to NHS and hepatitis C, and we believe that it's important to know what we're supposed to be doing and how we go about referrals these days. And then we also have got our face-to-face events. So the next one is scheduled for the 26th of June, where we're going to discuss frail patients, elderly patients, and nutrition. And again, all the information is on the website, on the Lincolnshire Training Hub website. I'm going to stop sharing that now with you guys, and then I'll get the Positive Health presentation. Ladies, do you want me to share presentation for you, or do you want to share it yourself?
Either I can share it from my end, or if it's easier to do it through you, that's fine too.
I'll do it from my end, probably, if that's okay then.
Cool, yeah.
And you just tell me when to. Now, can you see it as a big screen, or can you see absolutely everything on my screen?
Yeah, we can see it as a big screen as it's presented.
As it's presenting?
Yes.
Yeah.
Okay, over to Positive Health.
Okay, thank you. So, hello everybody, I'm Alice, and this is...
I'm Leanne, I'm Social Care Manager here.
Yeah, so we obviously both work for Positive Health Lincolnshire. So I'm the Health Promotion Lead at Positive Health, and obviously, as Leanne said, she's the Social Care Manager as well. So we're just going to start off by telling you a little bit about Positive Health, who we are, and giving you a little bit of history and background. So sure I can on for you, or not actually. Oh, sorry, I don't know if I've just taken that off again. Sorry, just a few technical difficulties, I think. There we go. If we could just click onto the next one, that would be brilliant. Perfect, thank you. So we are Lincolnshire's leading sexual health charity. So we provide assistance to people who are living with HIV in Lincolnshire. So once you receive a HIV diagnosis, you will be signposted to use our service, which Leanne will tell you a little bit more about as we work through. We have a few different departments at Positive Health as well. So just a little bit of history for you to begin with. So we were established as a HIV and AIDS voluntary group in 1985. We then received charitable status in 1995, and then our name was changed to Positive Health in 2000, just because it provided a little bit more confidentiality for our clientele, and it reflected the work that we do a little bit better on for people as well. So In terms of departments and what we do, we have 3 different departments and then a kind of sub-department, if you will. So we have the social care team, we have the health promotion, training and education team, and then the outreach team, which also includes our HIV drop-in testing service as well. So I will pass you over to Leanne, who's going to talk you through outreach, and then we'll go from there.
Yeah. So like Alice says, we have 3 main departments, and outreach and education are our prevention services. So outreach, we have 4 outreach workers, and the outreach workers attend PSE sites, which is public sex environments. So that's generally where men meet up, generally in, well, meant to be private areas, but generally lay-bys and areas like that where it is mainly for sexual activities, but it's generally men who have sex with men. So they don't get, and some are heterosexual men, but they are a very hard to reach. But reach out to the target group, and that is.
Sorry, it's difficult to hear you, I'm afraid.
I will get closer.
Yeah, has everyone got the same problem when the signal is breaking up a little bit?
Everyone.
Yes.
Right. We have rubbish internet. So.
No, it's not Windows.
So I will try and speak a bit slower and I'll come a bit closer. Is that any better?
Yes, it is at this moment, yes.
Right. Okay. So yeah, so it's that they are a hard to reach group on the PSE sites, and mainly people that will not attend the sexual health clinic. They're not likely to go and buy or obtain condoms, so they are actually quite a high risk group. So our outreach team go and target those groups to try and educate them and talk to them. They give them condoms to ensure that their activity is safe. And also it's about building a professional, trusting relation with users, because a lot of them do have issues and around their sexuality, but there's a reason why they're using these sites that they won't be able to speak to anybody about. So building up that with the outreach workers enables to get some emotional support for those people.
Ladies, I think we keep losing you. I think if you switch off your camera, sometimes it just does help a little bit.
We'll see if that helps. Right, okay, so that's off. So hopefully, can you hear us?
At the moment, yes.
Yeah, this is.
It sounds like you're too far away from the computer. If you come closest to the computer, that might work.
Let's do. I think it is because of our internet. A lot of people use it, so if there's a lot of people on it, that could be the issue. But hopefully, this works a little bit better now. Right. So hopefully you heard some of the outreach bit, but we also offer HIV testing sessions. They're point of care HIV sessions, which means that they're a very quick and easy test, and the results only take 60 seconds. So this is a service that we offer and is open to anybody. So they can call up and book an appointment, but we have a drop-in testing session on the first Monday of every month in Lincoln at our Positive Health office. And we also do alternate months for North Lincolnshire, which is Grimsby and Scunthorpe, which is the second Wednesday of every month. Obviously, we can share this information with you guys, but it's a really quick and easy test. Like I say, it takes up to 60 seconds, and it's a finger prick test. It's an antibody, so we don't need any personal information. We don't take names or numbers or anything, which I think is quite attractive to a lot of people. So it is very confidential, and if we were to get a positive or reactive result, we would then refer on to the local clinics, and we would support that person in attending that appointment for confirmation tests for that person through. So that we also have a camper van twice a year, which is very discreet. There's no signage on it, and we also go out to the outreach PSE sites, so we can offer those hard to reach groups the HIV and syphilis testing, and we also refer them and signpost them to other clinics if they need to use them. Something that we've been doing for a while, but fortunately now something which enables that to continue for a few years. And that's actually, we're getting a lot of uptake on that. But again, we can share.
We're losing you again.
How are you? I'm so sorry.
I think
Right.
if there is a little pause every now and then, I don't know, it seems to be working a little bit better.
We'll move on. We'll move on to health promotion and down department. And hopefully you may be.
Oh, now we've definitely lost you because it's all very echoey and broken.
I think whether we can take off our internet.
Sorry, we're not able to hear you at all now. It's all very broken.
Okay, I think hopefully when we've had a few members of staff come on the internet, it might be a little bit easier for you to hear us if you can.
Yeah.
Now.
We can hear you now, yeah.
Okay, wonderful. Hopefully it will get a little bit better in a moment. I'm just going to see what we can do about that. So I'll hopefully try and talk you through the next section of our service, which is health promotion and training. So the way our service runs here is we visit, we kind of have it in two different sections. We have the education side, so we go into schools and colleges all over the county of Lincolnshire, and we deliver a variety of different workshops in those schools. So on the slide there, you can see the collection of different sessions that we do offer. So it's anything from puberty, positive relationships, and introductory sessions to LGBT for primary schools, and then we move on to STIs, HIV, a lot of work around kind of pornography, relationships, contraception, risky behaviour, and so on in the secondary schools. So we go in, deliver these sessions to the students that way, and usually we get some really, really good feedback on responses to them. I think having an outside speaker come in and deliver the lessons to the students is usually quite beneficial to them because they're a bit more relaxed, let's say, to ask different questions they might not ask if it was their teachers delivering the same lessons, and we can open some kind of quite healthy debates with the students really about their own thoughts and opinions on things as well. So that's the main education side of things, which is a really good preventative service that we offer. And then we also have our training and health promotion side of things. So we attend lots of different events around the county as well to promote the service that we offer and also promote sexual health and educate people on the services that we do offer. So examples of those would be going to things such as freshers fairs or different colleges when they have open days. The most recent one we attended was a college in Stamford. We went to their mental health awareness week and did some work around stigma for HIV and STIs with them. And we're going to a service in Waddington in a couple of weeks' time on their kind of Families Day to educate people a little bit more about the service we offer there as well. And finally, we do offer an adult training service on HIV as well. So we go into different organisations such as the council, GP surgeries, pharmacies, and so on, and we offer education on HIV awareness as well, just to further people's education on things such as that, really. So it's a very big service with lots of different elements to it, and obviously the main idea of health promotion is preventative work, educating people before it's maybe relevant to them, whether that's at school or, you know, to like learn a little bit more about their sexual health and how cautious they can be. So I will pass you back to Leanne, who's going to run through social care with you. Is the sound a little bit better now?
Yes, it is.
Right,
So-
we've
Sounds
told
great.
every member of staff to come off the internet till we're finished.
Thank you.
So so social care. So I'm the social care manager for the department, and it aims to support people living in Lincolnshire with HIV, but we support those infected and affected by HIV. So there are carers, friends and family that are very affected by it, however not infected. So we do support everybody. We offer a broad range of support depending on each individual's needs. The ultimate aim is to support people to enable them to live healthy and independent lives. So for some, that could be a very high level of intense support. And we're very fortunate that we can tailor make this support and we can be very flexible. We can see them once a week, twice a week, every day, if needs be in the early days, to get them to where they need to be. So to ensure they're attending all their appointments, they're adhering to medication and treatment well, they, financially stable, they're healthy, they're safe, they've got suitable housing. So we will ensure that every element of their life is safe and they are healthy. And then we will then just, it will be maintenance support to ensure that that level is still maintained, and review them on regular basis. So we have some clients that need long-term, high intense support, and let's say there's a varied range of levels of support that we do offer. Like I say, it's all very down to the individual. So each client is assessed when they come into our service, and then their support is tailor-made around their needs. There is no limited time of support, so we have supported people for over 20 years. Others come into service, need intense support for say 6 to 12 months, get them to where they want to be, and they're quite happy no longer accessing the service. But again, there is no time frames on that. So it's just mainly important to know that people can live a normal and healthy, happy life living with HIV. HIV is not what it used to be. Most of our patients are taking as little as 1 pill a day, and attending their regular appointments, seeing their consultants, taking their meds, having their regular bloods. There is absolutely no reason that they cannot live a normal lifespan that they would have done if they, they hadn't contracted HIV. And I think the importance is, as professionals, it's to know that it's not the scary virus it once was. And again, as professionals, it's working together to try and reduce that stigma around what it used to be, and that people who are on effective treatment and have an undetectable viral load, it's U equals U, which is undetectable equals untransmittable. So if they have an undetectable viral load, then there is zero risk. Years ago, it used to be minimal risk, it used to be low risk, but now, after a lot of trials and research, there is zero risk. So there is no fear of passing it on to partners and even professionals. So yeah, it's about, we put a lot of work into reducing that stigma, and it helps people who have to live with HIV every day. So yeah, we're all very passionate about that, and we try to share that with other health professionals to ensure that everybody is aware that it is not what it used to be. So hopefully that's been helpful, but that is our service that is our service in a nutshell. I think you wanted to know a bit about either a case study from either of us or some examples of things.
Thank you very much, ladies. I think, again, it's very important for us primary care professionals to know what are the other teams out there that we can use when need be. And I think having a separate session just based around HIV would be really beneficial for the future. What are the new developments and so on. I think, again, in a primary care, just thinking outside of the box, sometimes with the contraception for young girls might be used for period regulation, but perhaps if we sense that there might be a problem around sexual health or any sort of relationships, puberty and so on, again, it might be a good idea to think, oh, I know Positive Health, I will pass on details, how for the individual to contact you directly. Would that be the preferred method? Are you okay with individuals to get in touch with you guys?
Yeah, absolutely fine. That's what I was also going to say, is that we take self-referrals, or we take referrals from professionals. So yeah, it's very easy. Just contact us by phone or email and we will take over from there. If there's any concerns, certainly HIV related, if there's any concerns around HIV, then send them straight to us and then we will refer them to the relevant service. And if it's sexual health related, then obviously, yes, people can ring us for advice and we will refer on. As for education, any issues that they have in the school, they can then go to the education workers and speak to them direct. And then if there's any issues, they can tailor make workshops to their particular need if they've got a specific need in schools. So yeah, I think the important thing is if you have patients with sexual health or HIV concerns, then yes, just refer them towards obviously or the clinic if there is you know, a clinical need there. Or if you're unsure, just always send them towards and we will always guide them in the right directions, sexual health or HIV related.
Thank you very much. And then again, because at the Lincolnshire Training Hub, we do like to think outside of the box and we do like to think about portfolio working. So if any of the practices, if any of you from different practices today are thinking, well, actually looking back at my population, perhaps we could do a pop-up event, just like a health promotion event in a car park outside the surgery or in the waiting room. Again, I'm sure if you get in touch with the ladies from Positive Health, we can help, they can help and arrange that. It's just that positive engagement with your community, with your patients.
Yeah, absolutely. Yeah, no, that is very important. And again, like yourself, thinking outside the box, we have done some sessions and are going to be doing a lot more sessions moving forward with GP practices and student nurses, just to be looking again. People need to look outside the box, because a lot of our clients that have had late diagnoses, it's because they're not stereotypical patients. You know, we've had white British females, 50 years old, that have never been offered a HIV test, but they've been very unwell for a very long time. But HIV was never thought of because of the sort of demographics that they fit in. So it's just about, you know, having HIV in the mind, thinking it is a possibility for anybody. So again, it's having that awareness as well.
Definitely. I am sharing now on the screen a QR code. If you could take a moment to just take a photo of the QR code and do the feedback form. I do realize we had the problems with the internet. We will try to maybe check the connections beforehand, before the next event. Sometimes these are things that can't be helped. But if you have got any suggestions for any future sessions, again, just put it in the box and we will always try and accommodate topics that you've requested. And again, I think at some point in the future, it would be great to have a session focused on HIV and what we can actually do with those patients, what we can tell them initially and then pass them on to probably your service.
Yeah, we're more than happy with that. And like I say, due to the internet issues, what we will do is just summarize today in an email and send you some links and details, contact details, so everybody's got them. And then if there are any questions, at least everyone's got the details there.
Yeah, if that's all okay with everyone, I will send you an email with all the contact details. Thank you. Right, so I'm gonna stop recording. Haha, it's not that easy to stop recording.